Hello everyone, I'm student nurse Angelica D. Contreras from BSN2-12A Group 2. Today I'm going to demonstrate Leopoldo's maneuver. This is an abdominal examination which will help us to determine the position of the fetus. While doing this procedure, we're going to use our bare hands. So we need to perform hand washing to deter the spreading of microorganisms. So now that we are done washing our hands, first is we're going to introduce ourselves to the client and identify the client's identity. We do this in order to check or verify that we have the correct client. And also, we're going to explain to the client the procedure that we are going to do so that she can participate cooperatively throughout the procedure. And also, while talking to the client, we are going to establish rapport to gain the client's trust and let the client be comfortable around us. So now, let's meet our client. Hello ma'am, good day. I am student nurse Angelica D. Contreras from Davao Doctors College. Can I hold your hand? Okay, can you please state your name and date of birth?
Okay, my name is Melanie Joy Kahayag. My date of birth is November 18, 2002.
Okay, thank you. And how would you like me to call you?
Just call me Mel.
Okay, Ma'am Mel. Are you with someone right now?
Yes, my husband is waiting for me outside.
Okay, that's good. By the way, do you know what are we going to do today?
Yes, we're going to know the position of my baby.
That's right. So today, I'm going to perform the Leopoldo's maneuver, which will help us determine the position of the fetus inside your womb. And while doing this, I'm going to use my bare hands to touch your abdomen. Is that alright with you?
Yes, it is alright with me.
Okay, so the only thing you need to do is you're going to lie down and just be comfortable, okay?
Okay.
Okay, so before we start, can you please empty your bladder?
Sure.
So, assuming that the client have already emptied her bladder, so it is important to ask the client to empty her bladder first because this will help the client to be comfortable throughout the procedure. And also, for the contour of the fetus to not be obscured. Okay, ma'am. Thank you. Do you need or want anything before we start?
Nothing really.
Okay, thank you. So now we're going to let the client lie down in a supine position and with the knees slightly flexing. While doing so, we're going to assist the client. While doing so, we're going to assist the client. Okay, ma'am Mel, please lay down. Okay, are you comfortable?
Yes.
Okay. If you are right-handed, you are going to position yourself on the right hand of the patient or the client. And if you are left-handed, you're going to stand on the left side of the client while facing the client. So before touching the abdomen of the client, we are going to scrub our hands to make our hands warm. Ma'am Mel, I'm going to expose your abdomen now, okay?
Okay.
Okay. Now we're going to face the client and palpate the uterine fundus to determine what part of the fetus lies in the upper part of the uterus. Then we're going to palpate it in a downward direction. Gently but with deep pressure. So we're also going to include the side of the abdomen. We're going to determine the position of the fetal extremities, fetal back, and the anterior shoulder. Next is we're going to place one hand over the symphysis pubis here and grasp the lower extremities using the thumb and the fingers, the between, like this. Then we're going to support it here. So we're going to feel the presenting part. So then we're going to turn and face the client's feet. We're going to confirm the findings of the third maneuver and determine the flexion of the vertex. Okay, now we're going to locate the back of the fetus, which is here. Then we're going to place the stethoscope to listen for the fetal heart tone. We're going to count for 1 full minute. So we're going to use the bell when listening for it. Okay. Now we're going to note for the location, rate, and the character of the fetal heart tone. Now that we are done with the procedure, we're going to assist the client back in a comfortable position and cover her abdomen. So, now Ma'am Mel, I'm going to cover your abdomen, okay?
Okay.
Now we are done with your examination, okay?
Okay.
So after that, we are going to document all the observation that we have. So in the documentation, this will include the fetal presentation, the attitude, and whether it is engaged or floating. And after we are done with it, we're going to do hand washing to deter the spreading of microorganisms.